the meeting of the Texas Early Learning Council to order at 11 a.m. I'm Reagan Miller. I am the Director of Child Care and Early Learning at the Texas Workforce Commission and proud to serve as your chair for the Texas Early Learning Council. So welcome to all of the members. I do want to note we have Sarah Kirkgard from the Office of the Governor who was going to be joining us today. I don't know if she's been able to join us yet, but we're looking forward to her participation in the meeting as soon as she's able to be here. So if you see Sarah Kirkgard join, she is representing the Governor's office. A reminder that we are producing this as a Zoom webinar. You guys are, all of the members are participating as panelists. Members of the public are able to participate in listen only mode. So for all of the members, remember to keep your electronic devices on mute. Remember to mute yourself when you're not speaking. And of course, Megan, our Interagency Deputy Director for Early Childhood, will mute us if we forget. She is going to be helping us today facilitate this Zoom meeting. I also want to remind everyone that there was a deadline for submitting written comments at 5 o'clock yesterday, but members of the public, if they would like to provide oral public comment today, can still do so by emailing their request to Megan Schneider, and she has put information, I believe, into the chat that everybody can see. So if anybody that's joining us from the public is interested in providing public comments, take a look at the chat and there are instructions there. Okay, with that, I'd like to ask all of the members to refer to the meeting material. We provided the July 2021 meeting minutes. So I wanted to see if anybody had any edits or changes to those meeting minutes. And if not, I would request a motion to approve the draft July 2021 meeting minutes.
Motion.
Okay, and I should have reminded everybody to say your name before you speak for the record.
Amber Scanlon, motion.
Okay, thank you. A motion was made by Amber Scanlon, and we would need a second to the motion.
I will second Catherine Abba.
All right, Catherine Abba. And with that, Megan is going to conduct a roll call vote, which will also serve as our what is it going to serve as? Attendance call. So Megan, over to you.
All right, thanks everyone. So when I call your name, please reply for, against, or abstain. So Dr. Catherine Abba.
For.
Sarah Abrahams.
For.
Travis Armstrong. Weldon Beard. Terry Breeden. I know I saw Terry join. Terry, you might be on mute.
I'm here.
All right, are you for the meeting minutes, the approval of the meeting minutes?
For.
Great, thanks. Dr. April Crawford.
For.
Rochelle Daniel.
For.
Dr. Alfirma Giles. Alfirma, I know I saw you join.
For.
Thank you. Melissa Hoisington.
For.
Becky Huss-Keeler.
For.
Kim Coffrin.
I'll abstain. I wasn't here in July.
Julitha McDonald.
For.
Dana McGrath.
For.
Reagan Miller.
For.
Teresa Robledo.
For.
Stephanie Rubin.
I will abstain also because I missed the meeting.
Kirsten Schwab.
Sorry, I will abstain as well. I missed the July meeting,
June
but I'm
Yateman?
here.
Okay. June Yateman? And Audrey Young.
Four.
Great. The motion to approve the July 2021 meeting minutes has carried. Thank you all, and I will pass it back to you, Reagan.
All right, thank you. So next is our public comment portion of the meeting. I know that we did receive one written input. Megan, if you will take care of that and let us know if there's anybody who has requested to speak today.
Yep, we have no requests for spoken testimony, but there was, as you mentioned, that one request for written. So that was shared yesterday by email. If folks have any questions or want to discuss that written testimony, you're welcome to right now. And otherwise, we have no other public comment.
Did everybody have a chance to read that written input? So for the public, I will just say, I don't have it pulled up, Megan, so I can't remember the name of the individual. The message that was being conveyed was a request for the state to consider the mental health impacts that the pandemic has had on early care providers and consider any types of supports that might be available to assist early care workers.
Correct, and that was from Marissa Barrett with United Way of Greater Austin.
Great, thank you. Later on in the meeting, I'll give an update on funding that the Texas Workforce Commission has made available to all regulated childcare programs. I will note that that funding is available to support any operational cost. Providers can determine how to best spend that money, which could be used for any type of supports that they want to provide. So that money is very, very flexible and up to the provider's discretion on how to best invest that to meet their program's needs. Since we have no additional public comment, then we'll move on to our fourth agenda item. And this is the standing agenda item that we put onto the list following the last meeting that we had a few months ago. We had a really great, robust conversation about the strategic plan that was developed. And we decided that this would be an ongoing agenda item so we could continue to discuss progress that's being made on some of the specific goals and strategies in that early learning strategic plan. So for this meeting, we've decided to focus on strategic plan goal 6, which you can see on the slide, talking about coordination across early childhood systems and the underlying data systems that support a high degree of collaboration. So we had sent out to all of the members a request for you guys to consider this strategic plan goal and to come ready to talk about what progress your organization or the constituency that you represent has made or is working to advance regarding this strategic plan goal. So I want to open it up to the members and see if folks have some information that they'd like to share about this. So it sounds like we don't have a lot of takers on data collaboration.
I can start, Reagan.
Okay.
So some of mine will be sort of questions we've encountered and conversations we've had with stakeholders and partners and inside agencies and many of you. One is certainly around following kids in ECI into school-based programs, even childcare, in that the TEACS data system, it does not conform to the PEAMS data system in TEA. And I know there's been some, obviously some data integration type discussions around that and how we can invest in a system where those two data systems can speak to each other, but also there's been interest in looking at longitudinal impacts of ECI on school-based, need for special ed, whether there's a reduced need or, maybe less intensive services that are needed. And so that kind of integration would be really helpful, both, to make sure that schools can get enough information about the little kiddos coming in, and also that we can, look at the effectiveness of the program and where it has the biggest gains. And I know there are other people on this call that have more experience on that issue than I do, but that's one that I feel is something that I know inside the agencies that there's already a lot of interest in trying to address that. I don't know what steps have been taken in terms of investment in data system, but that's one I'll just raise. The other one that I've encountered recently is around the issue of how many kids are attending licensed childcare, in whatever, whether it's, family home or in a center. What we have on the TWC side is, given the investments over the last couple of years, is much more information about how many kids are in subsidized care and where and so forth. But outside the subsidized system, it's much harder to figure out how many kids are in any particular placement. We know what the placement capacity is. That's what HHSC has. And so this has come up recently. Well, it's come up in lots of ways as people try to figure out how to address childcare deserts. And Kim Crawford knows a lot more about that than I do. But even more recently, when we've looked into the COVID positivity rates reported by childcare centers to HHSC or to dishes, they're not big numbers, but we don't have the denominator of, we have so far 10,000 kids and 11,000 caregivers that have been reported by childcare as being positive for COVID since the pandemic began. And, we know there's about 1 million plus kids in childcare, I think. So that rate is not huge, but I have had researchers ask me that question, even by region, especially where there's regional spikes. And it's hard to provide that without that kind of data. So I feel like that should be a goal we should think about, is actual enrollment as opposed to capacity. And it seems to me there's differences. And then the last thing I'll mention is we've been working on with some people on this call and others to try to develop a dashboard. Currently, we're calling it kind of a kindergarten readiness dashboard, but that's more holistic, that has some holistic indicators and measures to it, including, access to healthcare and coverage, maternal, mental health, poverty rates, food insecurity, access to quality childcare, things that relate to the experiences, the positive or challenging experiences of young kids before they would get to kindergarten. And so we've been working on that draft with a number of partners, and hope to partner with Cynthia Osborne at UT to make it interactive and available publicly and operationalize it. And we're just in the very early stages of that. And we're talking to some philanthropy that's interested in supporting that work. So I wanted to mention that I know there are other efforts out there at both measuring and looking at data more holistically. So that is potentially something in progress that I wanted to mention to folks.
Yeah, that's good. I'm gonna say a few words in a minute about early childhood integrated data systems, ESIDS. But before I do that, I do want to open it up to other members to get a sense of anything that might be happening at the local level to try to work cross-program. I'll talk a little bit about what the state is considering, but wanted to open that up to any other members to see what additional thoughts you might have.
I can share, this is April Crawford. I can share a couple of things that we're doing at UT Health with the TechPed platform, the Texas Early Childhood Professional Development System and Workforce Registry. So one of the things that's going to happen in about a month is we will release the first workforce sort of index report for TechPeds. We have about 50,000 early childhood professionals on the platform now, and we have really pretty good data, clean data, and enough data to feel confident for about 19,000 workforce members. So that's kind of a big milestone for TechPeds to finally be at a point where we feel really good about the integrity of the data that we can put out there. So the first workforce report will come out, and that data will be really important for feeding into systems like the TexR3 system. One of our big goals in the next 2 years really is, we've got about 19,000 educators and professionals on there with good data. We've got 50,000, that we've got another 30 basically where we really need to collect more information before we can feel good about including them in sort of data sets that people can interact with and that can feed into other people's systems. So what we're really focused on right now is continuing to implement new strategies that get data in ways that are easy for participants. So we're exploring ways to start using system queues where if someone has a registry account, they're in, but they haven't been active for a while, we can actually sort of ping them and queue them with brief questions that allow them to kind of submit brief chunks of information that are sort of readily available for them in ways that are more convenient, than saying, hey, today I'm going to go log into TechPeds and update my record. We want to make it something that's more convenient than that. We also, I think in about a week, we have our first meeting with AgriLife, and they are a really large provider of professional training for the child care workforce in particular. And we're very excited because what we'll be able to do through that partnership is automate certificate transfer into TechPeds for all courses and certificates earned on their AgriLife system. So that's going to really help participants, people, registry users. It's really going to help reduce the sort of load for them. They will no longer have to come in and upload information into TechPeds if they complete something with AgriLife. It will just automatically come into their record. So those types of data integrations are what we're really pursuing. We have that in place with another large provider, CPEI. We've started to share the conference tool with more organizations so that anytime data comes in from the conference tool, that again gets data into the workforce registry account without having the teacher, administrator, or specialist have to do it themselves. So I think we're really excited to release the first report on the workforce. So it's exciting, and I would love to. I think what we really want to do is collaborate with agencies who might have certain data elements that they want to prioritize. Because as we move toward this system where we can queue and collect, specific, smaller chunks of data, we want to make sure we're prioritizing the data that people really need. It's also, I shared it in the last meeting, but we were also able to use TechPeds as a way to rapidly deploy surveys of the workforce. During COVID, we've now done our third COVID-related survey that includes a component around stress. And what's nice about surveying the workforce from TechPeds is the members use their personal email accounts. That's how we encourage them to make sure that their record stays with them no matter where they go. So it means that even while employees are out of work, even when a teacher is no longer working because of COVID, say, or because of turnover for some other reason, we can still hear from them and learn more about how they're doing. So we really think in the long run, the registry will also be a way to launch special data collections where we can learn more about job and occupational turnover because of that level of access that they provide. So those are kind of things that are happening with TechPeds that are exciting. And it was kind of nice. We used TechPeds to do those sort of rapid COVID surveys And we published a paper and an interagency group with OPRE, ACS, and Institute of Education Sciences at the federal level asked us to come and present those findings to all of their interagency work group members. So it was really nice to be able to share what we've done in Texas with TechPeds and to show sort of the dedication of our workforce at a federal level.
That is exciting.
It is. The other thing we're doing that I would love, to know more about how this could be feasible is, I know there's more work happening in childcare to be able to have children receive a TSDS ID while they're in childcare, so that when they move into the public school system, they already have that identifier with them. And what we're really finding is we're increasingly serving infant and toddler classrooms, by the many thousands at CLI through CLI Engage. So we're collecting a lot of interesting data, milestones checklist information, red flags. So we're also really interested in knowing how we could support our providers that we work with to have children enter into TSDS and have that ID before they enter school, public school.
That's good to know. You know, we've, I think, I always call it the PEMS unique ID. You use tell me the acronym you just used.
I may not be using the right term. I use the TSDS, the Texas Student Data System Identifier. That's what we label it in the CLI Engage system. But it may be that it's called the PEMS ID.
We'd have to rely on TEA to tell us the right thing to call it, but I think we're all talking about the same thing.
Yeah, it's fun because everyone calls it something different. So at TEA, we usually call it the
This is Cherry Braden. It's the unique identifier.
Yeah. Thanks for that comment, April. I know that in our state interagency group, we have also talked about opportunities that PEMS unique ID brings.
Megan, this is Firma from the Texas Head Start Collaboration Office. I've been speaking with Megan about this. We were talking about the unique identifier as well, and I'm so glad to hear this conversation because it is so needed. And I think it would really lessen a lot of our efforts, especially for children transitioning. And I think that it's long overdue, and I would like to see the council provide support in this effort statewide, because it can't be one entity working on this. It will have to be all of us. And I was happy to hear April say that, because we have had discussion, Megan and I, and she's been very transparent about in the discussion with us and meeting with myself and another collaboration director from Arkansas to talk about how we can do this in our state. So I would really like to see us do this, because it would save us a lot of headache and a lot of I would say doing the same thing over and over, recreating the wheel, and children can just easily transition because they would already have that unique identifier. So this is really, really important. Thank you so much. I'm glad April brought this up.
Great. And that may be a good segue into the next slide, which I mentioned earlier, early childhood integrated data systems, or ECIDS. So we've heard this concept, and we've actually received a lot of input from stakeholders about the need to better integrate data for cross-program collaboration and data-driven decision-making. Stephanie, you just mentioned a lot of good questions that better integrated data could help address. So I wanted to, on behalf of the group of early childhood interagency agencies who meet on a regular basis, and you'll see at the bottom of the slide that that team that's listed, we have been having a lot of discussions about an ECIDS in Texas. So just at the highest level, ESIDs integrate data. You have multiple agencies providing services to the same kids, and an ESIDs can integrate that data across agencies to really help get a more comprehensive picture of the kids that we're serving. And so these 5 agencies have been discussing the development of an ESIDs, and really, before you jump into developing a system, we've been talking with a lot of national experts who said, before you jump right in, you really need to think strategically about what it is you're trying to do. What are those policy questions that you're really trying to understand in more detail? So if you'll go to the next slide. We are beginning the development of a Texas ESIDS roadmap. So the roadmap is really intended to provide an overview of all of the Texas information for what we have in place now, but also take some time to address policy questions that an ESIDS could help answer. And we will need a lot of input from stakeholders in the development of these considerations for policy questions. Our expectation has been that we would work closely with the Early Learning Council and other stakeholders, but certainly the Early Learning Council, to think about what it is we want an ESIDS to do in the near term, and then thinking a little bit longer for the midterm, so that we could try to develop a roadmap that would really help guide us in the development of an ESIDS. We have been able to secure some technical assistance for the development of this roadmap and to help staff this effort from the federal PDG Birth to 5 Technical Assistance Center. So although our state isn't receiving the PDG grant, the Technical Assistance Center is still available to help us. So over the next year, we do plan on working across programs and with this Technical Assistance Center to develop this roadmap. And our plan has been to think about how we engage the Early Learning Council in future meetings as we're developing this. So if you want to jump to the next slide. Some of the key considerations that we're thinking about as we develop this roadmap, again, start with the questions you want to answer. We've been cautioned that if you just start thinking about all of the data you want to throw in, it can get pretty overwhelming. And if you can think strategically about what you want to answer in the near term and in the midterm, you can develop a thoughtful plan on how to roll something out initially and then build upon it through additional iterations. So we want to talk about those policy questions and then consider the scope, data governance issues, obviously funding sources, and then the technology that would actually be needed. And we really don't want to reinvent the wheel. And so we wanted to, some of these have already come up. The PEIMS unique ID, obviously we've been working on that on the TEA side, but the interagency partners have also thought about how can you expand PEIMS unique ID into other programs. TexR3 was already mentioned. And I wanted to ask Sarah if she'd talk a little bit. There's an early childhood systems integration group, or ESIG, because we all love acronyms, ESIG for short, that's also been in place. And so Sarah, if you want to talk a little bit about the work that's already been done in that area.
Sure. I think, again, I feel like we're a little bit not at the starting point, but still a work in progress. But essentially this early childhood systems integration group is sort of a data focused group of agencies that are all working with young kids and their families. And this was really a way for our agencies to begin to create a more centralized record or a more centralized accounting of already existing publicly available information about how kids are doing in Texas. And so for many of us, there are already existing legislative reports or federal data reports that we pull together that are vetted through our agencies and that allow us to look at population level publicly available data to let us know how kids in Texas are doing. And so this early childhood systems integration group is working on how do we create a more centralized way to look at all of that data together and really understand our more collective impact or our more collective approach to the impact that we may be having on families. I think this is still a bit of a work in progress and something that is, there's not like a link or a specific thing that exists right now, but is something that we've been collectively looking at and are working on sorting through how we might make more publicly available.
I also want to remind folks that the Texas Early Learning Council that was in existence several years ago, before we relaunched this new one, also did a lot of work. And we included a link in the PowerPoint, but there was actually a strategic plan that was developed that at the time called it a TOTS, the on-track system, but it was an ESIDS concept. And so we already have within the strategic plan a lot of the data analysis about the different systems that states have, general information on the types of data that each program collects. So we have a lot of work that we can use so that we don't have to recreate the wheel and start from scratch. There was a question in the chat about, Kirsten, I think you asked, are there other states that have done this? And yes, absolutely there are. And we're seeing more and more states that are moving towards the development of ESIDS. We were really fortunate. We pulled together from the interagency team the program people and the data people, some IT people, to talk this summer. And we had a couple of states who have put these in place come in and talk about what they've done and how they did it, just so we could all get a general sense of what the possibilities are. So yes, there are absolutely state models that are out there that we can look towards. And in fact, our PDG Birth to 5 TA Center has helped other states with these types of projects. So we're looking forward to their expertise in being able to help us as we develop this roadmap for how the state could consider developing and implementing an ESIDS and then continuing to build on that ESIDS over time. We did learn that obviously you generally start out small and you continue to add to it, that your first iteration doesn't have everything that you want, which is why this roadmap can be so important to help us really think about what do we want to focus on now, and then what comes after that. So that will be part of the goal of this roadmap exercise. So wanted to make sure that the committee was aware that this ESIDS roadmap is in progress now, and we should be getting rolling on this. We will, you will actually see a job posting that will come out from the Texas Workforce Commission for a data person that's going to focus on ESIDS. This staff position is going to work very closely with Megan and really help the entire interagency group as we work on this. So wanted to lay that out and see if there are questions or comments. And I see Stephanie has her hand up.
Thank you for the explanation. That's helpful. On the ESIDS and I guess the roadmap, can you clarify whether, it sounds like these are data that agencies report anyway, whether they have to report it to the feds or to the legislature, or that you're tracking. So this is state-specific data. It's not, you're not pulling things from like the census or the community survey or things like that. So that's the first question. And those get updated on whatever, schedule each agency has, but I'm guessing there would be some kind of schedule for kind of updating that. And it's probably not going to be monthly. I don't know if it's annually, but that may be part of your roadmap, is sort of how timely that information is. And then my other question is, can you remind me, I'm a little thick-headed, what Tex R3 is?
Texas Ready Communities, oh gosh, I wish I had that pulled up. So it was the dashboard that was intended to look at communities, schools, and the workforce. I wish Allison was a panelist, because she would know. This was, if you actually go to texr3.org, we have a website that discusses it a little more. We are still working to get all of the data up and posted on that website, but it's combining data from TEA and then childcare data from Texas Workforce Commission, and CLI is assisting with some of that for the TRS perspective. Oh, good. And Allison put a link.
Yeah. Okay, that's helpful. Yeah, I mean, I would just say, on the ESIDS piece, and since I brought up this other kind of dashboard, we're thinking of, just to clarify for people, that one of our goals, and we'll work with the ESIDS folks to make this a reality, is that we're not highlighting data that somehow looks in conflict because of how it's reported, issues related to that. So we don't want policymakers to look at two different dashboards and get really confused, like, oh, kids look like they're doing great in this measure on this site, but over here it looks, bad because of a different way of looking at it, different data that's highlighted. So we're, one of our goals is to make sure that, it's not duplicative, but at least it's in alignment, so that even though there may be some separate data sources that are used, so that policymakers can get a clear picture from all these opportunities about how kids are doing and how the state's doing.
Yeah, no, good comment. We'll certainly put those down as considerations as we think through this roadmap.
Again, just following that train of thought. So,
and for the record, this is Kim.
Oh, sorry, Kim Crawford. Sorry, children at risk. See, you miss a meeting and you forget those habits. So, so with the ESIDS, which I think this is fantastic, and looking forward to it. And can it be ready tomorrow? Piece, but so looking at questions, obviously the data that we already are collecting, right? That all the agencies are currently collecting, but like to Stephanie's point earlier, for kids enrolled, would this be a process to ask those questions of things that we aren't collecting currently that we would want to collect and share?
I think that's certainly something we can put on the table. I will say, from that enrollment perspective, generally an ESIDS can only include what's being collected. And so the actual design and the roadmap of the ESIDS, in all likely, that short term is going to think about what's available now.
Yeah.
If we're thinking about enhancements, then obviously we would have to put those down as, is data available? On that enrollment side, I will remind everyone that while this is not mandatory, it's an optional way of collecting data. We have that availability portal where childcare providers can input how many available seats they have, and also put their enrollment numbers, so we can get a sense of how many kids are actually in care. And then we've been working with the Texas Policy Lab at Rice University to analyze license capacity versus what's being reported in the system, which is really helpful for us to have an understanding of really where the industry is on attendance versus actual capacity. And we're in the process of trying to get that data updated right now. Stephanie.
Right. And I had another question, but I lost it. So go ahead, Stephanie.
Okay.
Think of it again.
Thank you, Kim. Stephanie Rubin. So just one question that's kind of about disaggregating, and I don't know, and whether you can say whether these discussions are still happening about how we would make sure we're looking at these data with an equity lens. And so looking at, disaggregating by, race, by other, even by region, but also we find with a lot of data that it's not so clearly available for like the prenatal to 3 age, that some of the kid groupings are pretty large. So that would be just another, I know people on here care about that, but I just wanted to mention, to the extent that we can drill down into, a kind of narrower set of data that can be used to see who's doing well, and where there are gaps would be really helpful, especially on the equity side.
Yes, certainly the data use cases about who needs access to the data, what type of access do they need, considering all of those elements about how you slice and dice the data, how you make reports available, and certainly data security about how information on young children is reported is really important too. But yes, sir, I think all of those things are things that we can consider as we develop a roadmap for how this system could be designed. And any other interagency team members have comments, you guys feel free to chime in too. Kim, did you remember your other question?
I did, and they're saving it all for you. They're letting you take all the questions. I did, I think you just kind of answered it, but is the vision for this to be a public facing, so similar to your childcare by the numbers platform that, any of us can go grab that information, or is this just, would be wonderful, but it's also just to have that information that when we do a public, information request, that all that data is in one spot. But so I was just curious if there's a vision there or not.
I think we have to talk through all of that. When we talk to some of these other states, they did have public facing information. And so they were able to determine some of the policy questions and reports that they wanted the public to be able to access. It's interesting when you look at different states, how they display that information is very different. One of the states that we looked at, it was a lot of information. And so if you weren't truly a researcher, somebody looking at it with a very critical lens, it might not resonate. And so thinking about your audience is also important as you're thinking about making information available to the public.
Yep.
Yes.
Yep. Okay. Looking forward to the continued conversation. This is awesome.
All right. So if there are no other questions or comments, just know that this is going to be something that we'll be having many, many more discussions on with you and with other stakeholders. Okay, we are going to move on to our 5th agenda item, and that's updates from some of the council members. So we have a few updates this morning. So everybody knows we're going to have an update that Stephanie Rubin will introduce. Then we'll have an update from Dana McGrath at ECI, followed by an update from Terry Breeden at TEA. So the first one, I'm going to turn it over to Stephanie Rubin, who has some folks with her today to provide us an update on the PN3 Collaborative. Stephanie, over to you. Or perhaps Stephanie wants me to introduce them, I'm not sure.
Hi. Did you guys, I'm sorry, I had to step out for a second.
Oh, that's okay. So Stephanie, I was just saying that you brought some folks with you today to provide an update on the PN3. So do you want to introduce your colleagues?
Yes, I will. I'm sorry about that. So I thought there would be more questions for ESIG. So first of all, we are part of a leadership group of a prenatal to 3 collaborative, which is the other 2 partners are Children at Risk and Text Protects and Texans Care for Children. But we have a huge collaboration statewide of people involved through work groups, through getting information and coming to meetings and so forth. And the vision, This got started a couple of years ago with some support from the Pritzker Children's Initiative. And we have some additional funds from other Texas philanthropy, which is wonderful. And I wanted to introduce a couple of our important partners to share some of what we're doing statewide, and also give a local example of what one community is doing around prenatal to 3. So I want to introduce first Jess Trudeau, who is the managing director of Tex Protects, and she's the Hefe, the backbone leader of the collaborative. And many of you probably know her. And so she's going to give kind of the statewide update. And then I think Faith Rivera is here, and she's from My Health, My Resources, Tarrant County. And she is a community alignment coordinator for Help Me Grow North Texas. And so she's really deeply involved with Laura Kender and others on the local level in Tarrant County, really trying to elevate prenatal to 3, figure out the right services and programs. And also a big goal of ours is to educate policymakers about policy opportunities to improve outcomes for parents of young kids and young kids. So Jess, should we start with you?
Yeah, that'd be great. Yeah, thank you. Thank you, Stephanie. And yes, it's good to see so many friends on the call. So I wanted to start off because I've learned recently that many people don't know this work. Our largest funder, of course, is Pritzker Children's Initiative. And Texas is really fortunate to be one of the states in the country that have 2 grants from the Pritzker Children's Initiative. So Stephanie shared the first grant being a 5-year support of a 5-year plan for the Texas Prenatal to 3 Collaborative, with a vision of ensuring that all Texas babies are born healthy and have equitable access to health services and early learning supports in their homes and communities. And within that 5-year plan, we are tracking on ensuring that more than 400,000 infants, toddlers, and family members, additional infants, toddlers, and family members have access to such services. Texas also has a second grant, so a multi-year innovation grant. And we're so excited to partner with Faith and Laura and our friends at MHMR on this grant, in which they pilot interventions, which then can feed into the statewide plan. So we can go to the next slide. Stephanie mentioned that we have a broader steering committee over this work, in which MHMR, Laura Kender, serves on the steering committee, but also, as Stephanie mentioned, we have 3 lead organizations. If we could go to the next slide. 3 lead organizations. And so before I go through what we've been focused on over this last year with all of you and with all of the advocates across the state, Texans Care for Children, we have 3 buckets of work. Texans Care for Children is holding the Healthy Beginnings work, which is focused predominantly on continuous coverage and funding of evidence-based programs. Children at Risk is supporting the early child care and education portion, and then Tex Protects the prevention and early intervention portion. This is a super brief presentation, so I'm going to very briefly share with you what our focus points have been over the last year and where we're going next. So we can go to the next slide, and I'll start with Healthy Beginnings. Again, along with all of you and all of the advocates across the state, we were grateful to see HB 133 and HB 2658 passed, which focus on extending postpartum coverage to 6 months and removing eligibility checks for children that can remove them from Medicaid during the last legislative session. Additionally, a significant amount of attention went to ensuring that there was continued level funding for both Texas EAM bundles as well as ECI. If you're not familiar with Texas EAM bundles, these are evidence-based, hospital-based programs that have been demonstrated effective at improving maternal mortality and morbidity. So now that all of this has been accomplished, thanks to all of your support, we can go to the next slide, and I'll briefly share where we're focused going into our second year of the PN3 Collaborative. And so, of course, we're going to continue to monitor the implementation of HB 133 and 2658, ensure that the state and federal government is working to draw down the necessary funding, particularly for HB 133, and then to examine the current investments. Level funding was passed for ECI, but we want to continue to examine the current investments in ECI in order to inform our recommendations going further. On the next slide is what our focus area was on and what we were grateful to see passed during the legislative session in connection to early childcare education. And so we're really grateful to see HB 2607 and HB 1792 pass that were focused on TRS. HB 619 focused on workforce development, and then SB 1555 focused on reimbursement rates. In terms of where we're going next, on the next slide, we will continue to monitor implementation specifically of 2607 and 619. We can go to the next slide. Also, we're going to continue to evaluate the impact of early childcare deserts, and specifically the impact on the economy, to look at and monitor the expenditure and allocation of federal relief funding, as well as to continue to examine child teacher ratios. Finally, in our third bucket of work, which is prevention and early intervention, and that's on the next slide. We were really grateful and advocated hard on behalf of ensuring that at a minimum there was maintained funding for prevention-based programming out of Prevention and Early Intervention Division of DFPS. We also worked to lay the groundwork for the establishment of health services initiatives in the future. In particular, we're focused on utilizing this funding for the expansion of universal home-based visitation programs, and an example of such program is Family Connects, and then protection of funding for prevention that is associated with FFPSA. In terms of where we're going next, there was no movement during session on closed loop resource and referral systems, and that is a big piece of the supported families bucket for the PN3 collaborative longitudinal agenda. So we will focus on that, as well as establishing diverse funding to support scalability of Family Connects or other universal home-based programs. And then finally, supporting Texans Care for Children in examining the impact of existing investments in ECI and where we need to go next. Finally, just looking broadly at our work, I wanted to share a couple things. Over the next week, we will be sending out an application for parents to join a parent advisory council. We anticipate that we'll have 10 to 12, and this will be a statewide council, both to elevate voices of parents and ensure that we are considering lived experience when we are developing our policy agenda. But also the longer term vision is that next year, 2 to 3 parents will actually join the steering committee for the Prenatal to 3 collaborative. We have just entered into a contract with a consultant to support us on another key priority, which is racial equity. We have hired a consultant to support us on utilizing a racial equity lens in policy development and diversifying our leadership and work groups at every level to ensure that we are always utilizing that racial equity lens in developing and implementing policies. And then finally, in addition to supporting and submitting interim charges, we want to continue to engage the business community to advocate on behalf of infants and toddlers. And so I said this would be super brief. That was super brief. But at this point, I believe Stephanie is going to bring Faith up. We'll be happy to answer questions after.
Okay, great. So, and I'll just say briefly about the state piece, because we just had a conversation about ESIDS, and then we have obviously the Early Learning Council, which is really important. Is what Jess is talking about is really this external coordination of voices, community voices, advocacy organizations that maybe previously we're working a little bit more, sometimes together, sometimes a little ad hoc, and we're really trying to be much more in alignment with all these policy goals, but also to communicate very clearly that early childhood, we will help improve the early childhood experience of kids and families through many different systems. It's not just childcare, it's not just healthcare, it's not just pre-K access. All these things are really important. So Jess laid out kind of the policy agenda, which covers, many, even not all of the important elements to a healthy early childhood, but some of the key ones that we're working on. So Faith, I'll turn it over to you, who comes to us from Tarrant County.
Thank you, Stephanie. Good morning, everyone. My name is Faith Rivera, and I'm the Community Alignment Coordinator for Help Me Grow North Texas through MHMR of Tarrant County. And so I'm excited to give a local example of some of our prenatal to 3 efforts. We're really excited that we are in strong collaboration and alignment with the state efforts. Our plans, if you look at them, are very well aligned strategy-wise. So our first strategy is really around expansion of our Help Me Grow North Texas system, which is a closed loop screening referral system. So we have a centralized access point where families can call in or be referred in to receive developmental screenings, social determinants of health screenings, and really look at connecting families with the appropriate resources and closing the loop to make sure there was successful connection. In coordination with our state, we're also developing a family leadership council where we will have 7 lead family partners who will kind of lead an effort of a council of 40 individuals that span across our 18 county service area. We are launching a on-demand free training platform in partnership with First 3 Years called Teachable, where we will have quality trainings for all early childhood providers available, and that will be launching January 1st. We are continuing to expand our usage of the results-based accountability system throughout all of our subcommittee work so that we can show impact through data and use that data to make decisions. We also are working with the Center for Nonprofit Management to create a visual dashboard that shows when you implement several evidence-based programs within a community, what does that look like for families as well as the system? And we've been able to utilize our Help Me Grow North Texas Family Navigators in response to some of the needs of the community. And so we were partnering with Fort Worth ISD back at the beginning of COVID last year, around April and May, when they saw a large percentage of families not returning to school virtually. And then when everyone went back to school in the fall of last year, we were able to partner together to be able to try to find those families that were lost in the school system, connect them with resources, and get them re-engaged with school. Next slide, please. So our next slide focuses on showing our regional and state expansion efforts for Help Me Grow North Texas. In the light blue, you can see our 18 counties for Help Me Grow North Texas. We started in Tarrant County back in 2019. And over the last 2 years, which we'll be celebrating our 2-year anniversary on the 30th of this month, we've expanded to 17 additional counties. And we are supporting in North Texas the additional state sites for Help Me Grow. We serve as a demonstration and replication site through support of Title V funding through dishes, and we're really excited to continue to see that expansion. Next slide. We are very heavily integrated within all of the state efforts for Learn the Signs Act Early. Laura Kender, our chief at MHMR for Child and Family Services, serves as one of the 2 state Learn the Signs Act Early ambassadors, along with Claire Naide from Dishes. And this Deputy Ambassador program with 12 deputy ambassadors integrated within all Help Me Grow sites across the state, as well as several state agencies that are represented here today. We focus on training and distribution of materials to them so that they within their systems or within their local entities could really celebrate milestones with families and integrate these high quality materials. Next slide. So our second strategy of our grant and of our action plan is really around mental health consultation. So this focuses on working within pediatric settings as well as childcare settings on mental health consultation, which focuses on a 3-tiered approach. So looking at that whole center or whole clinic, focusing within specific pediatric providers or within specific classrooms, and then focusing within individual children, really looking at behavior and social emotional supports to ensure that the providers feel adequately supported in working with that child or within that center, as well as the individual child level. We have several grants that are focusing on this expansion, as well as integration and making sure that there's always a trauma-informed lens and really focusing with those families and those providers on TBRI and ACEs support. Next slide. We are also looking at increasing referrals within our Help Me Grow North Texas system to ECI prior to 12 months. So how do we make sure that those babies are being found as early as possible? We were given approval through the state to be able to pilot Help Me Grow North Texas being the ECI front door for all non-medical referrals so that a developmental screening could be done to ensure that the families that need to access ECI are able to access, but those families who are not likely to qualify can be connected quickly with other resources and referrals that they need. And that's been going since about the beginning of March. So I'm sure Laura will have some data for folks in the near future to be able to share the successes and see if that is going to be integrated long-term. We also are looking at utilizing Learn the Signs Act early as a way to educate families on their developmental milestones of their children to be able to get them connected with ECI or other programs as early as possible. Next slide. Healthy Steps is a continuation of our mental health consultation project, really making sure that mental health professionals are integrated within pediatric settings. We have 5 different sites that are kind of up and running or currently expanding within different health systems across our area. I know that Dallas is in the process of adding a site. I know there's other sites across the state as well that are getting up and running. And Healthy Steps is really strong in making sure that families of that 0 to 3 space have access to the mental health supports that they need, as well as regular developmental screenings. Next slide. Family Connects, I know that Jess mentioned this at a statewide level, that they're really focusing on expansion. We are strong underway locally as well. This is another amazing opportunity for partnership that really the groundwork was laid with Help Me Grow North Texas, but is now expanded into Family Connects North Texas. So we have an east and west side of implementation here, west side being Arlington, Fort Worth, and some of our surrounding rural counties, as well as the expansion currently into Dallas. So really focusing on that universal nurse home visiting programs for families as early as possible to make sure that they are being screened, early identification of any kind of needs that they have, and getting families connected to resources. Next slide. And then lastly is focusing on families accessing quality childcare. So really focusing on the infant toddler space, looking at fiscal mapping. And this was another project that started locally, but is now expanding across the state, looking at where is our funding coming in from, where is it focusing on, and how do we address any gaps. And we're hoping that this can continue to inform policy, expanding quality rated programs within Tarrant County, as well as expanding access for career pathways progression for childcare providers. Next slide. And then, like I mentioned, our 2-year celebration. So we made the decision this week to actually move this virtually. So any of you who are not local to North Texas, but would still like to come and hear what we're working on, as well as celebrate with us and the amazing progress that happened in just 2 short years, from being the first site in the state of Texas to launch on September 30th of 2019, to now being the largest site in the state of Texas that is also being a model and demonstration site, I think is amazing progress that we're excited to celebrate. So I'll put my email in the chat here, and any of you who are interested in attending virtually from 12:30 to 2 on the 30th, please let me know. We would love for you to attend. And I believe that is my last slide. So I think we're now into questions.
Thank you, Faith and Jess.
All right, do we have any questions from members? So I had one question on one of the slides. You were talking about centralized access for parents to call, and I thought you had 211 on there.
Yes, so we are in partnership with 211, really focusing on the API connection. So our data system is called Find Connect for Help Me Grow North Texas, and that houses all of our resources and data for families to be connected. So we are literally any day now going to have an API connection with the 211 system for 17 of our 18 counties, just to make sure that we have all of the resources that 211 has available, as well as the ability to keep those resources better up to date. And we are listed within several of our, I think we have 3 211 operated programs within North Texas. And so we are listed as a referral source for 211 for families who need a little bit more case management support than just the resources that 211 can offer.
Got it. Thanks. That was really helpful. I appreciate that. Members, other questions? All right. I will say on the on the PN3 work, looking at infants and toddlers, I want to remind everyone, I think many of you probably know that the Texas Workforce Commission recently approved rate increases for childcare that go into effect October 1st. And one of the things that we did was create, we use our market rate survey to set those rates, and we selected a higher percentile, a higher benchmark for infants and then for toddlers. So for example, our Texas Rising Star programs used to be benchmarked to the 75th percentile. Now infant 4-star rates are benchmarked to the 85th percentile and toddlers benchmarked to the 80th percentile. So we were certainly giving some consideration to a lot of what we've heard about the need to create more opportunities for serving infants and toddlers in light of how scarce those seats are and considering the cost of care for those younger ages. All right, we appreciate the updates, you guys. Thank you very much. Okay, and next we're going to have an update from Dana McGrath with ECI.
Okay, thanks, Reagan. And hi, everyone. I'm Dana McGrath. I'm the director for the Texas Health and Human Services Early Childhood Intervention Program. And I wanted to use some time today to provide the council with information on the Child Find Self-Assessment, which is an ongoing project here at ECI. And you can go to the next slide, please. So before I dive in and begin sharing about the self-assessment, I wanted to first share some information about Child Find in general, in case some of you are not familiar with this requirement of the Individuals with Disabilities Education Act. Child Find is a continuous process of public awareness, screening, and evaluation for identifying children who are eligible for IDEA Part C services, which of course are delivered through the ECI program in Texas. Our federal statute requires that the state have a comprehensive child find system, and the corresponding state rules require our ECI contractors to have procedures and systems to inform referral sources about ECI services, including things like our eligibility criteria, the array of services we offer, how to make referrals to ECI. They also require contractors to have processes to accept those referrals effectively and to monitor referral dates and sources. So basically the purpose of Child Find efforts is to establish working relationships and communicate effectively with referral sources to educate and promote the referral of children who are potentially eligible for ECI services. You can go to the next slide, please. So to support these efforts, the Health and Human Services Commission ECI program used the Voluntary Child Find Self-Assessment, or CFSA, tool developed by the Office of Special Education Programs with the goals of identifying best practices that may already be in place within ECI programs across the state to address child find requirements, discovering gaps in our child find efforts, and developing a plan of action to duplicate those best practices. We identify and address those areas of improvement that we identify on a statewide. And the areas on which we chose to especially focus include children who are referred but found ineligible for early intervention services, children who were referred within 6 months of their 3rd birthday. So what we would consider a late referral. And I heard Faith talking about that as a priority of finding those kids early within the first 12 months if possible. So that is something that we're interested in as well, finding kids early who need our services. And lastly, identification of infants and toddlers who are underserved by Part C. Okay, perfect. So using that CFSA tool as a guide for evaluating current practices, we solicited input from ECI contractors, referral sources, and also families in Texas via surveys and also family focus groups. And again, we were specifically interested in children who were not currently benefiting from services, including those eligible but enrolled late. So trying to dig into some of those things. And as you'll notice on this slide, we did receive survey responses from ECI contractors representing more than half of the 41 local ECI programs, than 1,100 responses from referral sources. So collected lots of good information through those surveys. And then to ensure that the family perspective was considered as well, ECI collaborated with the BUILD initiative to conduct family focus groups with the goal of better understanding families' overall experience and their experience getting referred to early intervention services in Texas. So those focus groups consisted of 8 parents who had children receiving services, as well as children who did not qualify for services. And we conducted those in the 5 counties listed there on the slide. Okay, thanks. And as we hoped for, we did hear through all that information gathering about both things that were going well as challenges and opportunities for improvement. Some of the feedback received from ECI contractors and referral sources included challenges such as fiscal limitations, increasing caseloads, and constraints brought on by the COVID pandemic. Parents who participated in the focus groups shared a lot of positive and complimentary stories about their experience and interaction with their ECI service providers, which we were definitely gratified to hear, but also shared about challenges they have experienced accessing services. And all of the results from the surveys and the focus groups were summarized in a report that identified various opportunities for improvement, including things like increasing information about ECI, including via social media in particular, providing more information on typical child development and community resources to families, improving coordination with pediatricians, and providing more opportunity and sharing information about existing opportunities for families to access developmental screenings in their community to help determine if their child might be eligible for early intervention services. You can go to the next slide, please. So now that we have gathered all of this great input, we are in the process of inviting a group of stakeholders, including families representing the diversity of our state, to join a work group to review the feedback that we received in more detail and recommend an action plan that will outline steps to address the concerns that were raised, build on successful practices that had been shared, and suggest some new practices to address areas where we think improvement is needed. And then once developed, that improvement plan will be presented to our ECI advisory committee. We'll also share it with ECI contractors and interagency partners for review and to be able to provide some input on the draft improvement plan. And certainly we'll be tracking all of the items identified through to completion. And we would welcome members of the Texas Early Learning Council to participate in the work group if any of you are interested. If you are welcome to reach out to me and I can get you connected to that work. And with that, I'll just say thank you on this last slide here for your time and interest. I hope it was informative to hear about this important project. And again, if anyone's interested in being involved in the next steps of digging into the findings with us and coming up with some action plans to address the things that we heard through this Child Find self-assessment, we would love to have your participation. So thanks.
Great. Questions, comments? Dana, that was a great update. I'm really curious to see what the findings were and what the recommendations are that come out of it. Very interesting. And now we're going to turn it over to Terry Breeden.
Looked like Stephanie might have had a comment.
Oh, Stephanie, did you have a comment?
I have a question. I'm not, if I don't want to take up too much time with my my ECI comments. One of them is on the question of, and this, I think what Dana, what you all are working on is really important. There's, you know, gaps in knowledge. There's referral sources that need more information. There's potential sort of, you know, cultural issues at play here about who gets information, who feels welcome, how do they hear about it? You know, do they stay in the program as long as we'd like them to, so things like that. One of the things you brought up, which is really interesting, is the question of the kids who don't meet eligibility. Maybe they did once, you know, in the past, but in any case, currently we have eligibility requirements for the program, which have been narrowed over the last, I don't know, 10, maybe it was 2010, 2011, 2012. And so when you're talking about solutions and what to do with kids who don't quite meet eligibility, is that something that you haven't had a discussion about yet, or are there some options that people have identified for kind of interim support? And maybe the child later, with, you know, before they turn age 3, will become eligible, but if they don't, they still may really need services of some sort.
Yeah, exactly. And I think, you know, that'll be one of the topics that we discuss with the stakeholders is, you know, what more can we do to strengthen what kind of handoff we're giving to families? Okay, we've done an evaluation. They're not eligible based on the current criteria for ECI, but how good of a job are we doing, and what else could we be doing to make sure they get connected to other resources in their community that might assist that family, or other programs that they might be eligible for? Or do we need to follow along with that family? You know, how are those processes working to check back in with them in 6 months or whenever is appropriate to see, you know, if something might have changed and the potential for ECI services might need to be revisited. So those are some of the things that are on our mind with that. You know, at this point, we haven't developed any of the action steps, but those are some of the things that we were interested in with that piece of the self-assessment and looking at kids, again, who aren't eligible for ECI.
Yeah, and I think you probably gave a little bit of this update last time in terms of federal relief money that came to the state for Part C. And then there's the potential for, you know, federal budget money that's still being debated that also would be an increase for Texas, which might offer a great opportunity for lots of the strategies you're talking about. So it's really good timing, because hopefully we can prepare to use that money wisely. So thanks, Dana.
Sure.
Thanks for your leadership. You've been doing a great job.
And Dana, there was a question in the chat from Kirsten. Are you working with TechSpan at ESC 10? Seems like there could be some collaboration around outreach and providing more info to parents.
I'm not familiar with them, so I'd love to connect with you, Kirsten, to find out how we connect with them and what the opportunities might be there.
All right. So we go from IDEA Part C to IDEA Part B, and Terry Breeden is with us.
Hello, I just wanted to share with you a new resource that TEA has released. We felt it was very important it kind of follows up some of the things Dana talked about. And we've collaborated and made a parent's guide to early childhood intervention and early childhood special education. It's available on the Texas Transition website. And I've shared with you that resource before. And in this parent's guide, it explains what ECI is, how the children may be eligible, what services they provide. And then it's primarily geared to the early childhood special education that we went over since it's our publication. So it has a lot about that, but it kind of explains the differences. And for instance, they may have the IFSP and we have the IEP. So it talks about that and the differences in eligibilities and services. But as children's transition from ECI to early childhood special education, there are quite a few differences. So it was a resource that we felt would be a good resource for the parents to have.
Fantastic. Thank you, Terry.
Sure.
And last but not least, I forgot to mention Jerletha, who last time, as we were talking about events, had so many wonderful things to update us about with her work with a congressional committee, with an Office of Child Care panel, and with some work she's now doing with the National Association of Family Child Care. Jerletha, you are a busy, busy lady. And so we're looking forward to hearing from you today on some of your work. And you're on mute. Okay.
Okay. Hello, everyone. Thank you. And so today, what I'm going to share is the work that I'm doing with the Office of Child Care. It's the Office of Child Care's National Family Child Care Provider Panel. I am a co-chair, and also I represent the state of Texas as a panelist as well. I'm co-chairing along with my friend and colleague, Jessica Sager, co-founder and CEO of All Our Kin Family Child Care Network out of Connecticut. And also I'm co-chairing with Lynette Dummis, who is the CEO of the National Family Child Care Association based out of Washington, D.C. And me, Jerletha McDonald, and I'm the founder and CEO of Arlington DFW Family Child Care Professionals. Next slide, please. So I am the co-chair and member of the Office of Child Care National Family Child Care Provider Panel. As a panel member, I have the opportunity to lift the voice of family child care educators and inform about the issues and challenges that family child care providers face on a daily basis. My peers on the panel and I have the opportunity to influence a set of guiding principles for developing early care and education systems and quality improvement approaches that address the unique needs of family child care providers across the U.S. The panel meets every other month and is hosted by the National Center of Early Childhood Quality Assurance in partnership with All Our Kin. On this panel is myself and 15 other family child care providers from across the United States. And all our opinions and ideas are going into this one pager. Our next meeting, we are finalizing the one pager, and it will be distributed once it's complete to across the United States on the guiding principles for family child care providers. And that's it.
Jerletha, we're really happy that you're representing us in DC and representing the entire family child care industry. We all know that family child care has been a critical component of our early care system, and we really appreciate your continued work to lift up the voices of family child care providers.
Thank you so much, Reagan. Thank you guys for your continued support and love. And also thank you guys for lifting up family child care in the state of Texas. We are so excited with all the things that's coming down the line for family child care, and we are excited to be included at the table. So thank you.
Great. All right. So that brings us to the end of our updates from members. Do any other members have any information that they want to share? And if not, we will jump to our federal stimulus funding update. I don't know if any of the members have questions about federal stimulus funding. I'll tell you that at the Texas Workforce Commission, I think you all know that we received a significant amount of these one-time stimulus funds. I think when we add it up, it's $5.9 billion, which is quite a heavy investment. We are continuing to implement. We've put out about almost $555 million in grants to childcare programs that we funded before the ARPA funds were put into place. The ARPA funds also have a requirement that about $2.4 billion will go out to childcare programs. So when you put both of those amounts together, we will be providing $3 billion in grants directly to childcare programs to help them with operating costs. So September 15th, so just a few days ago, we updated information on our website. If you go to our website, there's a red banner across the top. There's a childcare link, and that's where we're putting information about all of this money that we've received. You'll see updates on how much money we have distributed through the middle pot of funds, the SRSA funds. We also have that broken out by board area. So we've received a lot of requests asking for particular areas of the state, how funds were going in those areas. So just wanted to make sure everybody knew that was just updated this week. $555 million has been awarded, and you'll see the average grant amounts for licensed childcare centers are just over $84,000. For licensed childcare homes, $6,900. And for registered childcare homes, right at about $6,500. We are working to get the $2.4 billion out to childcare programs. We are expecting that we'll be able to release those in January of 22. These funds came with some additional reporting requirements, so we will have some work on our end to update data systems because we will be requesting additional information from childcare programs. This first pot of money that we put out, we really didn't ask for anything. We just sent the money out in the hopes that it would help with some of these immediate needs. We also are continuing to fund business coaches for all childcare programs. We have a website, childcare.texas.gov, that has information about all of the business coaching that's available, as well as information on these one-time grants. We are also going to be we are under contract with a few more organizations that are going to help us with our business coaching. So we will be releasing a press release shortly that will talk about contracts that we have with childcare associates focusing on center-based childcare, and with Avance focusing on family childcare. So we're working to get that press release issued, and we'll be including information on those resources on that childcare.texas.gov website as well. So with that, are there any other updates from members, or does anybody have questions? Stephanie, do you have a question?
I just wanted to mention on childcare, the very important effort going on to consider changes to ratios in childcare centers. HHSC is undergoing a review of those right now. We have some materials on our website. Children at Risk, I think, does as well. We produced a cute little video, I'll put it in the chat, that shows, it's challenging for one teacher to supervise and try to educate 11 two-year-olds. And so it's an opportunity for people to comment on, what's a safe and effective ratio in childcare. So I encourage people, if anyone needs some information about, communicating with HHSC about what they see in their research or locally, Kim Coffin or myself are certainly happy to talk with folks about that.
Thank you for that. Any other member questions or comments? All right. So we're getting to the close of our meeting. And we're a few minutes ahead of time, which is not normal. So let me point out that we have a proposed 2022 meeting schedule. We're suggesting quarterly meeting dates, and you'll see the dates on there: January 21st, April 15th, July 15th, and October 21st. And want to see if, I know last time we had some conflicts with different events, so I want to see if, as we're looking at these dates, if anybody knows of anything that we need to be aware of. Although, so as I'm looking at this, Megan, did you notice that April 15th is Good Friday? I just noticed that.
I did not. You could do the week before or after.
Yes, so we will need to do that the week before or the week after, either April 8th or April 22nd. Are there any preferences as we consider those dates? Okay, we'll send out an updated meeting schedule. I'm not exactly sure which of those dates we'll pick. July 15th and then October 21st.
Reagan, April 21st, that we said that's the week Build Shared Services Conference is in town. It's supposed to be back in Austin that week. Just so, I mean, that's earlier in the week and this would be Friday, but just as an FYI, when they rescheduled for the event. And then I don't know when Texas AYC conference is in October. I don't know if the 21st is that weekend or if it's before that. So you just may want to check with Cody and see when their conference is. That they should have the dates. I just don't remember what they are.
So I think we'll aim for April 8th in that case, since we have a choice between dates. And then we need to double check on the TACI conference. So we will look at that. All right. Uh-oh, Stephanie, your April 8th is your annual luncheon. That could be a problem.
Are we going to be in person this year, Stephanie? Maybe?
Yes, we are. Confident.
Then we could consider April 1st or April 29th.
Both of those sound good.
Mm-hmm.
All right. It sounds like we could pick either of those. So like I said, we will pick one of those. We'll send it out. We also need to confirm the October date to make sure we don't have a conference conflict. All right. Our last meeting agenda item are our updates on early childhood events. And so I think our first update is going to be from Rochelle Daniel.
Oh, I forgot this was still on the agenda. So this is just like our little monthly reminder of a little virtual webinar we're offering to families and communities about choosing safe childcare and the role that childcare regulation plays in licensing and regulating providers. So there's a link there, and I don't know if maybe Megan could put the direct thank you in the chat. So if you guys have people that might find that interesting, please share the link with them.
Thank you, Rochelle. And then April, I believe you have an update for us.
Yes, we have a conference next week, a virtual conference from our data squad. We now on Engage, we have almost 500,000 kids and 50,000 teachers and coaches and specialists that are on the platform each year. And the point of this conference is really to help everyone learn how to do more with their data, use it to inform instruction, to inform their professional development needs and priorities, and help them to think about how they use data incrementally to improve.
All right, thank you, April. And then finally, Sarah.
Hey, yes, this is just a formal announcement for our annual Partners in Prevention Conference, which is being held this coming November. It will be a bit of a hybrid model, so there will be both in-person and virtual opportunities and options, and we have a really exciting setup. There's the link in here or a Google search for Partners in Prevention Conference. Either way will lead you to the website, and registration goes live September 24th.
Thank you very much. Are there any other events that members would like to tell us about, or have we covered everything?
Reagan, I just put in the chat, Texas AYC's annual conference is coming up in October. Registration's still open. So Galveston, hopefully all the hurricanes are gone. So
all right, October 14th through 16th. So it looks like we do not have a conflict with that proposed date
that's
for
this year. That's
this year. That's this year.
Yeah.
We have to check on next year.
Next year.
All right.
I know. I look at dates
Still
like,
on
oh
our
yeah,
to-do
it is
list.
2021.
Well, keep it on the to-do.
Reagan, I have a question. This is Stephanie.
Yes.
When it is safe to come back together and meet in person, will we be able to? Will we have funding to support that? You know.
I will need to check and see because we've moved into sort of an unfunded early learning council. We'll have to check and see if we can come back in person, where we might be able to host it. I'm curious if members like the ability to participate remotely, because there could be some that want to be in person and some that would prefer to be remote if that assists with participation. Any thoughts on that?
I kind of like the hybrid model. You know, if we could meet a couple times a year in person and had funding and a couple times a year virtual, that would be what I would.
I mean, one advantage, I guess, of in person is if we feel like there is an agenda where we want to dig in a little deeper and spend more than this short amount of time on the phone, which is really hard to do virtually. But, you know, we had great meetings before where we had stuff on the walls and posters and, you know, if there's work groups that we haven't really been able to activate because of it's just challenging. So that just may be something to think about in terms of the agenda. So Kim may be right, like just for more update type meetings online might be fine. But if we want a longer, almost intensive meeting to reflect and consider kind of goals for going forward, in person might be better.
This is April. I really agree with that. I think if we had, you know, the ability to come together, it would be nice to have longer sessions.
Yeah, certainly. I mean, I think as we're starting to think about an ESIDS and wanting to have some kind of in-depth discussions about what this might look like, it could be helpful. And I don't know if this is a committee of the whole, if there will be some folks who want to volunteer for more detailed discussions. I think it could be helpful if we could actually have a hybrid that was in person and remote, but I don't know exactly how you would schedule some of us to be in a room and some joining by Zoom. I think we could probably figure it out. We'd have to give some thought to that. But if we were able to do that, then potentially the people who wanted to to be on a work group to have some more discussion on these data issues could be in person. So let us give some thought to how that might look.
That sounds good. Certain, I was gonna say, certainly universities, or we have the capability at Texans Care to have a meeting with people plugged in versus with video, but there would be other sites that would too. So we could probably be
Fantastic.
creative.
That's great.
Reagan, if I may, it's Kathy Abba.
Yes.
Yes, I kind of concur with the crowd there. I think sort of a hybrid model would be a good idea. It certainly is easier to attend this way, but I do think the dynamics of in-person really can make a difference. Just, if I may, just add a couple of quick thoughts. My first thought, Stephanie, going back to what you were talking about in terms of the important discussion about ratio, I was reading just a little bit prior to this meeting, and I can connect with you after the meeting, but I would be curious. I know that cost is a big concern for directors and providers in general. So I'm wondering what you're hearing. I'm wondering if you're also hearing that a concern is they can't find people, because I will say that this summer and fall, we at the community college, and I'm sure Becky could say the same at the four-year college, have never, ever received so many solicitations from potential employers for our students. I mean, they don't care how many courses they've had. They need bodies. People are absolutely desperate, at least here in the Houston area. So I'm just curious if you hear that the other part of that equation is not just money, but the pushback is also they can't find people for ratio improvement. Thanks.
Yeah, I mean, I'll just say, and Kim and others can weigh in. Yes, for sure. And that, you know, balanced with, of course, child safety, and also, you know, this process of revisiting the rules. It's, you know, it happens occasionally, and it happens on a sort of a set schedule based on either legislation or HHSD, you know, other rule review timing. And so, you know, this is the opportunity to make the change, whether that, you know, goes into place immediately or is phased in, or, you know, how that looks. Kim is going to be, or Rochelle are going to be better spokespeople about what that means. But I don't know, our view is we don't want to miss the opportunity, since they are going through this review, to kind of prioritize quality and safety. And I think the workforce and the funding are all integral to that. And we have to be figuring out all these things simultaneously, which is super challenging, of course. But I don't know, Kim or Rochelle, if you wanted to add anything there.
Yeah, I'll just,
for us, go ahead, Rochelle.
okay, all right, thanks. Yeah, I'll just add that, you know, for the comprehensive review that we are doing right now, yeah, it only comes along every 6 years. I mean, it doesn't mean we don't make rule changes outside of that, obviously. But what we're anticipating right now for whatever we propose, the effective date most likely would not be until February of 2023. So we're talking, you know, almost a year and a half away.
Thank you for that.
And Rochelle, even though if the majority of the rule changes would take that effect, there could also be, if ratios were in that pile, that could be pushed back even further if that's been done before on some other big ticket grandfather things. So.
Yeah, absolutely.
Well, I'm certainly glad that you are taking advantage of this opportunity. It's highly needed, and we certainly support it. But also, I just want to thank all of the presenters today, because I always gather a lot of information, not only to share statewide with all my community college colleagues, but our students as well. Everything that was covered today. So thank you.
All right. So with that, I will remind everyone that our next meeting is going to be on Zoom. We will start looking into this notion of hybrid. We're meeting November 12th from 11 to 1 p.m. If there are no other comments, I want to thank everybody. Thank all the members for being here. Thank all of the folks who joined us from the public to listen, and continue to thank everybody for our continued work as we think about the needs of our youngest children in Texas. So thank you, everyone. Have a good Friday, and we'll talk to everybody soon. The meeting is adjourned. Oh, do I need to make a motion, Megan? Or do I just adjourn?
You can adjourn and just.
Okay. The meeting is adjourned at 12:44 p.m. Thank you, everyone.
Thank you, Megan.